so we can get started. Tell me a little bit why, Kaitlin, sleep is such an important part of Benchmark and your patient's health status concerning longevity.
For sure. Thanks so much for hosting tonight, Kevin. Also just want to introduce Nancy too. So Nancy and I are co-founders of Benchmark, and I'm going to be talking a lot about sleep today. And so, why do we want to learn about sleep? So I've been sleep obsessed my whole life. My family thinks this is hilarious that I'm doing a podcast today. And my sister just texted me and said, good luck on your debut. And over the past 2 years, I've been retraining to become a preventative healthcare physician, which I now am. And I have learned so much about sleep. I follow a lot of sleep experts, and in particular, Dr. Matthew Walker, who's just doing such amazing work to raise the awareness of the importance of sleep. And a lot of what I'm talking about today, I've learned from him and his book, Why We Sleep, which I would absolutely recommend. And I'm so happy that I know what I know about sleep now. I definitely didn't know about this as a med student, a resident, practicing ER physician. And honestly, I just want to spread the word about how crucial sleep is for our mental, emotional, and physical well-being. And sleep is now what I consider the foundation of health. So everything, all of the other pillars come off of sleep. I now think about sleep as my number one, and nutrition, exercise, emotional well-being all come off of sleep. The other reason I wanted to talk about it is that at Benchmark, we have noticed that a lot of our members have a lot of aha moments with sleep. They walk away with a better understanding, and most importantly, they walk away with tips on how to improve their sleep. And then they're telling us how much better they feel when they prioritize their sleep.
That's amazing. And I think that was a big, I don't think I was too surprised given where I am in life right now with kids in terms of how bad my sleep was at times. But definitely it's a neat introspective look at how things go when it comes to sleep. And I think I thought I was doing a lot better than I was actually since taking your program. I guess before we get into everything about sleep, because this is such a growing topic, I feel even in our area of sports medicine, sleep has become so big in the last 5 years. Maybe we can start off by just defining what happens during sleep. I think some people are familiar with this idea of non-REM sleep and rapid eye movement sleep. So maybe you can break down the stages of sleep and maybe what's happening during each briefly.
Yeah, for sure. So I think we could start by talking about how sleep is divided into two categories. So we have non-REM sleep and we have REM sleep. So REM stands for rapid eye movement, and non-REM sleep is categorized into 4 further stages, really representing us going into deeper phases of sleep. REM sleep is characterized, I think this is really interesting. So it's rapid eye movements, but your body also undergoes paralysis of the voluntary muscles. And this is because in REM, this is really when we experience most of our dreaming, not all of our dreaming, but most of it. And when we're dreaming, we can act out things in our dream. And so our body protects ourselves and protects other people in your bed, if you're sharing a bed, by paralyzing the voluntary muscles. So you're not able to act out your dreams, which I think is really, really fascinating. And these stages, we cycle through these stages. So the non-REM stages and the REM stages throughout the night. And each cycle going through non-REM and into REM lasts about 90 to 120 minutes. And we cycle through these several times throughout the night. And what's interesting is that it's not all the same amount of time. So like the first half of sleep is mainly our deep non-REM sleep. And then our second half of sleep, we're more REM focused. So sometimes this can affect our early risers, because if they cut their sleep early, they may think, oh, well, my sleep is going from 7 to 6 hours. That's not that bad. But if they're cutting it early in the morning, they could be losing a significant part of their REM sleep. And each stage has unique benefits, which I'm sure we'll be going into as we go through the podcast.
Yeah, absolutely. And actually, that's a really good point, because I remember we've had this discussion many times. I am, for example, I tend to cut out a lot of probably REM sleep from getting some early workouts in throughout the week, just given my schedule, which maybe works at a certain point. Maybe we'll get back to this later, but there's definitely some detriments I would pay from that over time. from skipping out on that. So with that said, maybe we can circle back on some of the several system sleep effects. So if we look at some of Matt Walker's work and things along those lines, brain health and mental health is a huge one. Maybe you can speak a little bit about how sleep in general affects brain health.
Yeah, this is a massive topic. I mean, this is a podcast on its own, to be honest, but I want you to walk away with three things, with three ways that sleep affects your brain and emotional health. Number one, it helps our mental performance. So sleep helps us learn, it helps our recall, it helps us learn new skills, perfect those skills. It helps us keep mentally alert, and it helps our performance. And it also helps us solve problems. Like, it helps us integrate memories, which allows us to solve problems. Sometimes we'll wake up and we'll have a solution to a problem that we've been struggling with for a while, and sleep actually helps us do this. And then number two, I think this is obvious, but it's absolutely worth mentioning that sleep helps our emotional well-being. It reduces our anxiousness, our depressive symptoms. A bad night of sleep can really paint the world black for a lot of people, myself included. There's actually a study recently done, and the question that everyone was asked was, why do you care about improving sleep? And the number one answer was, I want to improve my mood. So I think this is really well understood among people. And in particular, REM sleep can really help this type of benefit. Dr. Matthew Walker, like I've mentioned, he actually coined REM sleep as emotional first aid, because it helps take the sting out of emotional events. The phrase "sleep on it" actually works, and for good reason. And then the last reason, which I think is less well known, and coming out in the research right now, is that sleep can be very protective against cognitive decline, and in particular Alzheimer's and forms of dementia. So I'm going to get a bit technical here, but I think that it's worth this discussion. So in our deepest phase of sleep, we experience something called a glymphatic rinse. And so it's like a power cleanse for our brain. So what happens is that our body uses our cerebral spinal fluid, which is fluid that coats the spine and the brain. And we experience this increased pressure in the brain, and it cleans out all of the debris that we've accumulated throughout the day. And this debris can be amyloid, tau protein, which has been well associated with Alzheimer's and with forms of dementia. So this deep sleep offers this cleansing. And so if we cut our deep sleep, then we lose the ability to cleanse this debris. But then what's worse is that the protein starts to accumulate in areas that help us get deep sleep. So it's this like vicious cycle. And research is coming out that this, could be indirectly associated with cognitive decline. So again, a really important reason why we're prioritizing our sleep and our deep sleep in particular.
Absolutely. No, it's so important when you think about those different perspectives. And I guess moving down, so we go from brain, mental health, we kind of look at our heart and cardiovascular system. What are some benefits of sleep, maybe on the longevity perspective with regards to the cardiovascular system?
Yeah, so in order for me to talk about how sleep benefits our cardiovascular system, I need to talk about our nervous system. So poor sleep causes overdrive of our fight or flight, which is our sympathetic nervous system. And what happens here is that this will cause increased levels of cortisol and adrenaline, which are known as stress hormones. And these stress hormones will raise our resting heart rate and our blood pressure. And over time, this increases our risk of cardiovascular disease. Alternatively, good high quality sleep communicates a calming signal to the parasympathetic nervous system. So it's the opposite. That's our rest and digest. And what happens is our vagus nerve, which is a big part of our parasympathetic nervous system, fires deeply, and our resting heart rate goes very low, and our blood pressure goes very low. And this type of sleep is a natural form of blood pressure medication.
Which is really interesting too. And I think maybe to clarify this as well. So as a mechanism of sleep, from what I've understood, it's the deeper sleep, REM sleep, that actually puts us into that predominantly like that parasympathetic.
It's the deep sleep. Yeah, the deep sleep actually does this. Like as we dive into deeper phases of sleep, this is when our sleep signals will send messages to the parasympathetic nervous system to get calm and to relax and to lower the heart rate and to lower the blood pressure. But when we're in fragmented sleep, or we're not prioritizing our sleep, or we're sleeping too little, we'd never get the chance to fire to the parasympathetic nervous system like we should. And so this sympathetic nervous system is in overdrive. And so the cortisol and adrenaline keep running, and we're not allowing ourselves to get into that relaxation state.
And I'd say like that's I guess the challenge of our society. Unfortunately, I think we're in a very sympathetic driven culture. Very go, go, go. People sacrifice sleep. And this is something that we talked about too. I think like even in medicine, how many, sleep has always been like for the weak and things along those lines. And consuming, which we'll get to later, consuming some things like caffeine and all these stimulants, but clearly you can see there's a huge effect on multi-systems.
And I think it's also like, sorry to interrupt you, but I think it's important to like stay on that point, because I think that sleep is largely underestimated. And I think that, just like you said, a lot of people associate, a weakness for a need of sleep. And I would say that's the absolute opposite. Sleep is our superpower, and we need to prioritize it. So I'm happy you brought that up. And in medicine, it's sort of ironic how little we pay attention to sleep. I hope that paradigm is shifting, because all of the literature is pointing to the disastrous effects of poor sleep, not only in performance, in managing patients, but also to physician, nurses, their own health.
Absolutely. And another one that we get a lot too, I guess, in the clinic, just being with more like physical care and gym routines. And if you actually look at a lot of studies looking at like why people tend to get interested in sleep, I think managing weight is a huge one. I was kind of going to lean into that. I guess this is another big topic. I'm sure we'll have a couple of questions around, but the idea of sleep and its role to affect things like hormones and our metabolism. I wonder if you want to maybe tackle that now and maybe explain why, maybe some underlying mechanisms of why sleep can do that.
Yeah, absolutely. So the study that I referred to before, where the question was like, why do you care about your sleep? Right. So the number one answer was to improve mood. And then the number two answer was, I want to lose weight. So I'll lead with weight loss and then maybe get into some of the other metabolic benefits of sleep. So what happens with poor sleep is that it plays tricks on our hunger hormones. So we have two hunger hormones. We have ghrelin and we have leptin. Leptin tells the body that you feel full, and ghrelin tells the body that you're hungry. When you're sleep deprived, leptin goes down, ghrelin goes up, meaning you feel less full and you feel more hungry. So this is like a double whammy. And studies show that people who are sleeping less consume on average 300 more calories per day than a well-rested individual. So this can easily lead to 10, 15 pounds of weight gain over a year. And then, in addition to, these hunger hormones, our metabolic health suffers as well. So sleep deprivation, this has been very well studied, raises your blood sugar levels. And there was actually a study showing that 5 days of a shortened sleep, so between 4 and 6 hours, showed effects of prediabetes in a completely healthy population. So I found that pretty staggering. So increased levels of sugar is obviously not what we want, right? Because sugar can be toxic. It's also hard on the body. Like the pancreas has to secrete more insulin. We can become insulin resistant. So good night's sleep protects our blood sugar. And what's interesting is people who go through the program, they often see this with their continuous glucose monitor. So a continuous glucose monitor, we have people who go through the program wear it for 10 days. And that's, giving us an estimate of their blood sugar. And we ask them to take a look at what their fasting glucose, like what the glucose is in the morning on a night where they've had a bad sleep versus good sleep. And they often tell us that it's up, and we can see it in the data, which I think is obviously really interesting as well.
Yeah, it's daunting. I remember in Matthew Walker's book, I think, I forget the stat too. I think it's like 4 or 5 days sleep deprived, and it's not even like full night of sleep. It's a couple hours a night, and I forget how much it ages you. It's like your blood sugar levels are that of somebody 20 years older. It's insane.
Yeah, it's similar to prediabetes.
Which is crazy how it can happen in that quick of a time span. So that said too, on that topic, so like obviously we talked about our stress hormones, we talked about basically how we modify our appetite and our eating behaviors. What are some other effects on the metabolic system regarding sleep?
Well, actually, I think that, you know, one other thing before we get into that is maybe the immune system, because I think I've kind of hit the highlights of the metabolic system. And so the immune system, I think I really want people to walk away with understanding the effects of poor sleep on your immune system. So one night of bad sleep reduces our natural killer cells. So our natural killer cells are produced by our immune system, and they target foreign material, right? So they target foreign cells, like a virus or a bacteria or a cancer cell. And there's a study that shows when you sleep less than 4 hours, we see a reduction in these natural T cells by 70%. So this reduction puts us in increased risk of catching infection. And this is kind of obvious, right? Like we know that, like when we're having poor sleep 1, 2, 3 days, and then we get sick, you know, I think all of us have kind of experienced that. The other thing I think is interesting is that poor sleep can affect our response to vaccines. So there is a great study showing that a group of healthy individuals were separated into 2 groups. One group slept 7.5 to 8 hours. The other group slept kind of 4 to 6 hours. And the group that slept properly had a 50% increase in their immune reaction to the flu vaccine. I mean, this should be a public health message, really. Like, if you want your vaccine to work, make sure that you're sleeping well before. And then I think another common topic around sleep and health would be hormones. And so, you know, things like your testosterone drops. This affects both men and women. So, you know, if you have 5 days of poor sleep, your testosterone can drop. And I think this is maybe what you're meaning, Kevin, to levels similar to someone aged 10 years older. And this study was done in men. So a group of men had poor sleep for 5 days, and their testosterone dropped to the level of a man 10 years older than them. But lower testosterone can affect a lot of different things in both men and women. So it can affect energy, mood, focus, muscular mass, bone density. And it also obviously affects fertility as well. And, you know, with poor sleep, women can also have effects with their hormone. So studies show that the FSH, which is like follicular stimulating hormone, can go down, which can cause menstrual abnormalities and can also potentially cause infertility.
Yeah, it's such a widespread effect. And to your point too, like I'm shocked that, especially during COVID, I remember the British Journal of Sports Medicine, a study came out saying those responding more favorably to COVID were those that were exercising. And yet you have this massive modifying factor of sleep that's not talked about at all, right? Where hopefully that's more of a mainstream thing. I think it is, just with the amount of attention that multi areas of research are diving into medicine and sleep for that matter. And before we get on to this, I was going to throw in another poll here because I think it's a good segue for what I wanted to ask you next. Sure. I was going to throw out a poll again. So this one would be, do you track your sleep? So if anybody potentially wears a wearable or maybe like old school pen and paper in terms of trying to time your sleep patterns, we'll open that poll up and we'll give everybody maybe a good 10, 15 seconds and we'll publish that off. See a comment there, Jeff, just saying he does track his sleep now.
I like that.
Okay, so I'll end the poll here. So hopefully, can everybody see that published? I don't know if you can, but so basically out of our votes, we kind of have almost like a split here between about half of the people looking at always tracking their sleep, some people saying sometimes they track their sleep, and a few people saying never. So to build on that and maybe we can talk more about why this is important, but at Benchmark, how do you guys track sleep, and how is that an important metric in somebody's overall health?
Yeah. So every member wears a wearable for 4 weeks, which tracks, among other things, their sleep. And we pay attention to a lot of different metrics, but we really pay attention to 3, to sleep duration, to restorative sleep, which is, the deep plus the REM sleep. And we also track sleep consistency. We track, like I said, for 4 weeks. We analyze this data, and then we give our members very specific advice based on their results.
Okay. And then what are some of the big findings that you've seen thus far in the program? What are some of the big takeaways from, and even as a physician, being able to track sleep? So that's, it's kind of an interesting thing coming from the ER to now being able to look, 4 weeks at somebody's sleep. Like, what are some of the findings and some of the insights that you found?
So the biggest takeaway is how alcohol affects your sleep. And alcohol, I think, is largely misunderstood when it comes to sleep. So alcohol will sedate you out of this wakeful period via alcohol. And it doesn't put you into a natural sleep. It's actually more like anesthesia than sleep. So it's a sedation, it's a sedative. And sleep or alcohol will hurt your sleep in many ways. So it fragments our sleep. So it causes several brief awakenings, some that you're aware of, some that you aren't. And then so what that does is it makes this not a continuous sleep and definitely not restorative. And so members start to see this. They see the frequent awakenings, and they also start to see, because we have members track their alcohol as well if they want to. And on the days that they track their alcohol, they can see the effects of their sleep the next day. And there's reason to this, the byproducts of alcohol, aldehyde and ketones, they cause a surge in cortisol, which causes our heart rate to go up. And that heart rate increase causes a feeling of palpitations, which I definitely have had after waking up, after I've had too many drinks. I wake up and I can have palpitations. And our members also see this in the data, that they wake up and their resting heart rate is 10 to 12 beats higher than it normally would, even if they had 1 to 2 drinks of alcohol. And then I think the most important part about alcohol is alcohol will literally blunt your effective REM. It almost completely obliterates your REM sleep. And just to remind you, REM sleep is our memory integration. It's our emotional health. And so, sometimes people can experience this, they feel like their emotional health isn't as stable, or that they're not reacting to things as well as they normally would. That can be the effect of alcohol itself, but it can also be the fact that REM sleep is completely destroyed with alcohol. So I think that's our number one takeaway from our members. People really talk about this a lot with me. And then the other takeaway is just an increased awareness of their sleep in general and their sleep habits. I think, like I said, people are quick to dismiss sleep. They're quick to put sleep on the back burner, or, I'll just take an hour of sleep off. And when we make them analyze this and then we tell them to prioritize it, we get a lot of emails back saying, guess what? I feel so much better, or I'm performing better at work, or I have so much more patience with my kids. The effects go from, not only performing better with workouts or at work, but to improved relationships when people prioritize their sleep.
That's really cool. How do you, out of all the other metrics that you look at, how modifiable do you find sleep has been in the program? Out of curiosity, because some of them are hard. Some of them they're big changes, they're lifestyle changes.
So modifiable.
Yeah. You actually think it's a decent one to get on right away?
Yeah, because for most of the members, people haven't taken a deep dive into their sleep. Nobody's forced them for 1 month to pay attention to their sleep. And the other thing about Benchmark is that, I'm watching all of their stats. So I feel like there's a bit of a secret sauce with paying attention to your own daily habits, having somebody else guide you through them, and having somebody to feel accountable to, or somebody to. And so I think that, I think we're probably going to get into some tips around sleep. When people start to really pay attention to their sleep, They realize that it absolutely is modifiable, but it's similar to exercise and nutrition, right? It's a diligence. Like it's 9:30, I'm going to bed, right? I'm not going to watch that extra show. I'm not going to scroll Instagram right now. I'm not, it's a diligence. And I would argue that good health requires diligence, and sleep is one of them.
Yeah, I found that was like the rudest awakening. I think maybe out of all my things that I went through, it was sleep. And I'd always taken pride in the fact that I've been a lucky individual that I can get to sleep quickly. And I thought that was the main measure of how well I slept. And it was very interesting seeing the metrics of how different things came out and how wrong I was. And I think that's a great point too. I think that was the biggest thing. I like moved with that actually specifically because they always send the constant reminders of I'm going to catch my optimal sleep. I actually needed that kick in the butt to actually be like, get to bed right now, or get to bed in the next half hour, or else, pay the consequences the next day.
Yeah, absolutely. And the other thing too is actually people walk away with a lot of sleep confidence. So sometimes people are like, oh, I don't know how I'm going to sleep. I'm kind of nervous for the sleep tracker. And then they're like, wow, like I have great sleep. And that translates into better sleep because people have more belief in what they're doing and see that the numbers are actually really good.
Absolutely. So I guess like the question everybody's probably waiting here to hear is how do we improve our sleep? And I know this is a large topic to tackle. So I don't know where you want to spearhead this one, but maybe from your experience in the program, maybe some of the more tangible ways to change sleep habits right away. I know maybe we've alluded to a couple already, with tracking being number one. What are some other common things that you tend to tell your patients about improving sleep quality and ensuring that it's helping their health in the long term?
Yeah. Okay. This is a great question. And, I talk about this so often that I sort of kind of figured out a way that I like to tell people how to tackle their sleep. So the first thing is to figure out your own rhythm. So what do I mean by that? Everybody has a different circadian rhythm, which I don't think is very well known. And this is largely genetically determined. There's 22 genes that determine your sleep chronotype. And there's 5 different chronotypes. There's an extreme morning. So those people typically go to bed around 8 p.m., wake up around 4 a.m. There's a morning chronotype, which is you go to bed around 9:30, you wake up between kind of 5:30 and 6. There's a neutral, go to bed at 11, wake up at 7:30. There's an evening chronotype, you go to bed at 12:30, wake up around 9:30. And then there's an extreme evening, go to bed around 2:30 in the morning, wake up at 11:30. There's actually a questionnaire that you can take to determine your own chronotype. It's called the morningness, eveningness questionnaire. Takes 3 to 4 minutes. You get an idea of where you fall in this chronotype spectrum. And it's really important to know where you fall on this spectrum because you want to give your body an opportunity to sleep at its prime time. And the sad part about this is that society almost doesn't allow our evening or extreme evening chronotypes to really survive that well in society. Society really favors the morning. And I hope that with more education and more awareness around this, that the workplace kind of changes their perspective on this, because it's really important for people with this chronotype with any chronotype to sleep when your body is ready to sleep. And so once you know the ideal time for your body to sleep, then you can do a couple other things to help you solidify your own rhythm. So one is light exposure. So light exposure in the morning will set off your circadian rhythm. So we want a lot of light within the first hour of wakening. Ideally, this is natural light. If you can go outside and get light, it hits the back of the retina. That blue light signals to your body to release cortisol, gets you ready for the day. And then alternatively, like at night, we do not want exposure to blue light because that keeps the cortisol surging, and it also delays the melatonin release. So melatonin is one of our powerful hormones that signals to the body that sleep is ready. And melatonin starts to rise when we have darkness. So when we have a lot of light exposure, sleep gets delayed. This is in the evening. So ideally, like as a practical tip, 3 to 4 hours before you go to sleep, you start thinking about reducing your light exposure, especially within 1 hour. Okay. And blue light from screens, if you can really shut that down 1 to 2 hours before bedtime. That'll be really helpful. There are some hacks like blue light blocking glasses you can use. There was a study that showed 2 groups of people, one group reading a book on an iPad, the other group reading a book, like a physical book. And then the group of people reading on the iPad, their melatonin was reduced by 20% and it peaked 3 hours later. And they also got less REM. So in the morning, they felt less refreshed. And this was all related to blue light exposure. And then so, on the theme of lightness, right? The other thing is to keep the room really dark. So you can use like blackout blinds, night hoods, shades to keep everything really dark. Any questions before I move on?
I always laugh at that too, because and I'm sure this comes out a lot, but I laugh at my wife and I. We prioritize our kids' sleep so much. Their rooms, you can't see a darn thing in the room. It's completely blacked out. And they sleep amazing. Like they easily 11 to 12 hours a night, no problem. So it's interesting that as an adult, I don't think about the same thing. And like even though we have like some blackout blinds, it's never a huge priority. It's like, oh, there's a little bit of light, like we'll figure it out, or we have a nightlight for them sitting in the room. Like we also don't do the same thing. And these are very simple things that are practical that it's great to hear about this, because I think a lot of people could probably look at the checklist and be like, yeah, I'll add this or try these things.
Oh yeah, especially like one of my friends, one of my Emerge friends, I something called the sleep hood, and it's like literally like a hat that goes on, and it's so soft and nice. But it's amazing. So like in the Emerge, a lot of us like really heavily relied on this to reduce our light exposure. But moving on, I think one of the other like practical tips is temperature. So trying to drop our core body temperature before we go to sleep, it actually helps us fall asleep and stay asleep. So what do I mean by that? I mean like hot shower, bath, sauna. It can be socks, it can be a hot water bottle. And what happens there is that the heat is released through our extremities, and that drops the core temperature. And dropping the core temperature will get us into sleep faster. But we have to keep the room cool. So keeping it like cool, like 65 degrees Fahrenheit, 18 degrees Celsius, like keeping the room really cold will be really helpful. This is why falling asleep in a cold room is much easier than falling asleep in a warm room. And then some of the other questions I get around sleep and tips is like, what about exercise? So exercise will absolutely overall improve your sleep. Just be careful of when you're doing your exercise. So a lot of times, we've been reading things like don't exercise 3 hours before you go to bed. But recent literature has shown that, even up to 1 hour before you go to bed can still be okay and can actually be beneficial. Those studies need to be a little bit more, improved and higher power studies, but I was interested to see that. But overall, exercise on a day-to-day, as much exercise will improve your quality sleep. And then the other thing I say is like, be really mindful of like the timing of your drinks and your food. So one thing, alcohol, we talked about, if you can not drink alcohol, that's better. If you do have an evening where you're going to drink alcohol, try to make that 3 hours at least before you go to bedtime or before you go to bed. And then the other thing is food. So late night meals will absolutely disrupt your sleep. First of all, it causes indigestion. And second of all, it causes your temperature to go up because we're using all of these resources to digest the food. Our core temperature goes up, and that makes sleep a little bit more difficult.
It's kind of interesting, yeah, because going back to that as well, because I think there's that misconception too, what you said with either a sauna or a hot shower. Everybody thinks like, okay, it's a warm modality, it's going to heat us up, where there's been some people that have gone into cold plunges before bed. That's you don't want to do that for the very same reason. You're just going to ramp up your metabolic rate, right? So
that's right.
So it's always good for like early in the day, because I think there are some studies out there showing like cold plunges and stuff earlier in the day is more effective for these things. And not to cut you off, but I actually had a question from the chat box too with Jeff.
Oh, sure. Yeah. Great.
What about things like background noise? So like white noise machines, things along those lines, having a fan running. Is there any evidence to suggest that that's beneficial or helps us get into any deeper way of sleep?
Yeah, so in terms of background noise, if you need the background noise to mute out other noise, then fine, that's going to help your sleep. But overall, like white noise, like it's not going to hurt you, but there's no studies showing that it's going to help. It's like more helpful for you to fall asleep. Like if there's like, you know, a party next door, or if you're in a hotel room, or, you know, you're somewhere where, you know, there's noises that are distracting you, by all means use white noise. But white noises also have been associated with fragmented sleep. And so there's no studies showing that this should be used on a day-to-day basis to benefit your sleep.
It's amazing. I think you're alluding to this too, but apart from like these things that we can add, what about things like regularity of sleep and timing and things like that?
Yeah. So that's actually probably one of our biggest tips that we can give people, is to keep their sleep consistency as close each night as possible. So what I mean by that is trying to go to bed and wake up sort of within 30 minutes day to day. People don't like getting that advice because it's kind of restrictive. But it is, you know, if we're saying that sleep is the foundation of your health, sleep consistency is probably one of the top 3 things that you can do to improve your sleep. And why is that? That's because it helps set your circadian rhythm. Like it helps you fall into sleep faster, get into those deeper phases of sleep quicker and for longer. So the timing of your sleep is really important.
And then something that I often think about, and we get asked a lot too, like what happens if somebody wakes up in the middle of the night and they can't get back to sleep, or they've been like, what are some strategies around that?
Yeah, this is really common. So when people wake up and they, you know, they can't fall back asleep, just like what you said. So some of the reasons for this is that in the middle of the night, we've done some cycling of sleep, right? So we've gone through some REM sleep, and we're not processing things the way we normally would in our wakeful state. So we have a higher degree of rumination. And I think most people can relate to this. So they start thinking about something and it's just like all the way down. So what you need to do is you need to get your mind off of itself. And so there's been some tips that I have heard from sleep experts that I'll share with you. One tip is to do like a body scan. So, you know, head to toe. I don't actually think personally this works that great. The other tip that I think works really well is to go through some sort of system using the alphabet. So like list cities A through Z. And the trick here is that you have to keep going back to it, because you'll be going back and forth between rumination and then the alphabet, rumination and alphabet, but you won't hit Z. And then the other one that I think is really helpful and interesting is to do like a mental stroll. And so what that means is like go through a walk that you have done thousands of times. So the walk that I use, I don't really know why, but is that I am going to my car. So I think about, okay, I'm getting out of my bed, what that feels like walking on the floor, thinking about the dark room, thinking about the space in my house, like even kind of thinking about what, what I may see or the smell, what it feels like to walk through my kitchen to get the keys to get to the car. I don't get to the car. I'm back asleep. And so that's a trick by Dr. Matthew Walker. And I think that's a really interesting one. And really the secret here is that get your mind off of itself. So whatever way you can do this, it really does work. The other thing too is that, meditation is something that is really such a hard habit to keep, personally for myself, and I've heard this from other people, but meditation in the studies clearly have shown that if you can meditate before you go to bed in particular, this helps you stay asleep.
Which is really interesting too. And I guess this is always a funny one too, because I just remind me like some of these tips, and like just with Matt Walker and his work, it's interesting, but like, what do you do if you miss a night of sleep? So let's say you've gone through the night of sleep, it's constantly disrupted, you wake up in the morning, it's going to be my life in like the next week. But what's like, what is the best strategy there? Is it something where, because I've heard some people like Matt Walker say like, don't do anything, try and survive, like try and push it as hard as you can to get to the next night. Naturally, I'd probably go to caffeine and do my best to stimulate myself to be awake. What is your advice around that?
Yeah, okay. So I tried to take a little bit of Matthew Walker and then a little bit of real life. So like if I were talking to you, Kevin, like, you're about to have a third baby. And so like sleep is sleep is going to be really tricky for you. So I would really kind of just talk to you about what that's like and what survival mode is like and how you're going to manage that. But let's take a more common example. Okay. For somebody who has had like a horrid night of sleep, or maybe 2-3 nights of sleep that are really bad. And what Matthew Walker is saying here is that just don't do anything. Like get up, do your normal day, don't have excessive caffeine, don't take the nap in the afternoon, because what happens is that your sleep continues to be disrupted. So his advice is like, suck it up for that day. And there's good research to show that, because, there's something called adenosine, which is a chemical in our body that increases as the day goes on. And this is our sleep pressure. So this causes us to have more sleep pressure. So caffeine will reduce that sleep pressure, and naps will reduce that sleep pressure. So what happens there is like, you've had a terrible night's sleep. You're like, okay, I'm going to have my morning caffeine, but then you're like, okay, I need an afternoon caffeine, and then I need a nap. Well, your adenosine, every single time you have caffeine or a nap, the adenosine doesn't have that same sort of pressure as it normally would. So you end up not having the same sleep pressure, and you end up going to bed later, and your sleep continues to be disrupted. So I understand what Matthew Walker is saying, but there's times when like, yeah, take an afternoon nap. It's not the end of the world, right? Like you're going to feel great after that. So I feel like, taking a little bit, with moderation and talking about naps can be really powerful. Like I really believe in naps. I'm like a pro 15-minute napper. Like I think it makes me feel more alert. I'm better with my kids. I used to do it all the time studying, like all the time. I remember just putting my head down. I could sleep for 15 minutes and wake up on my own without an alarm. And it would just improve my mental acuity. And so the trick with naps is just don't nap too late in the day. Try to cut it off around 1 to 2 p.m. And if you nap later or more than 15-20 minutes, you get into deeper phases of sleep. So waking up, you can wake up like a bear.
Absolutely.
Yeah.
So I'm being conscious of the time too, because I'm sure there's a lot of questions about, like, it's such an interesting topic. So we can continue to talk. If anybody has any questions, I just want to remind everybody again, you can throw them in the chat. I will address a few here in a second. I just wanted to also make a note too, that going back to the morningness, eveningness questionnaire, I did put a link to that in the group chat. So if anybody's curious of doing that later, they can copy that link. One question that came up here is there any research showing that mouth taping is effective with sleeping? That's kind of a hot one that I see on social media a lot and stuff now too.
Yeah, who asked that?
Karina actually did, my wife.
Oh, amazing.
I think we've been talking about this a lot. I won't give my opinion on this, but I'd be curious to see what you think.
Okay, so there's a lot of anecdotal research. I actually can't speak too intelligently about formal research that's been done about mouth tape. But the premise around mouth tape is that mouth breathing will disrupt your sleep. And also if you sleep with an open mouth, that kind of increases your risk of sleep apnea, or it can be like a telltale sign of sleep apnea. So sleeping with your mouth closed is better for your overall health for lots of different reasons. So mouth tape has improved several people's sleep in my sphere. Some benchmark members, Nancy's husband, Scott, my husband, Adam, they actually won't go to bed without mouth tape now.
Really?
Which is so funny. But really, like it really improves your sleep, and it also improves your quality sleep. And so, there's some tricks to mouth tape. First of all, you want to get like good mouth tape. So I would go on Amazon and I would get the mouth tape that's used for sleep. Like I wouldn't just get duct tape. It doesn't work as well. The other thing too is for men to shave their facial hair, because like the tape won't stick as well if you have a beard. But anecdotally, I would say that I now have I don't know, 10 to 15 examples of people who have had drastic improvement with mouth sleep.
That's really interesting. So follow up to that, just because you have the metrics. So in those that you know that, and maybe Nancy, you can chirp in with this as well. Have you noticed any like changes in your actual baseline metrics? So if you're looking at Whoop and you're following either time spent in deep sleep, what is the big change that you've noticed personally? Like if we go case study by case study, what are some changes that you're seeing? So I'd be curious to know this, because I've been on the fence for this for several reasons, and I'd be curious to see the results.
Wait, so Kevin, have you tried it?
I haven't.
You said you had opinions on this. Oh, okay.
Yeah.
Or you
I
haven't
have not
tried
tried
it?
I haven't tried it, but my husband swears by it. He's a diligent benchmark tracker and has seen it improve his sleep on his Whoop. But also it has improved my sleep because he no longer snores, or at least not nearly as much. So that's an added benefit.
Yeah, and I'll just comment too. My husband, now that he tapes his mouth, he has very infrequent wakings. Like before, if I got up to go to the bathroom, he'd wake up. He's not budging. Like his sleep is so much better. And Adam's like, he's a pretty analytical person. So he was like shocked that the mouth tape worked. I gave it to him. It took him like 6 months to try. And then when he did, he was like, what was I waiting for?
Yeah, I just find it's really interesting, because it's one of those things, out of all the evidence that's out there, it's one of the ones that I find it's making a huge splash in like popular circles. It's not there to back up, but that's very interesting to hear that. I thought I would have heard the opposite opinions. That's interesting. Maybe I will take the plunge and try that out. Oh, and I got another question in the chat here that I'll bring up. So how do you feel about CBD and THC to help sleep? So it's actually a pretty good one. So I'm sure it's along the lines of maybe how alcohol maybe works to some extreme or it goes. And,
yeah, that's a great question. Yeah. So I think it's also important to split out this in terms of THC and CBD. So THC in the studies have shown that it's disruptive for sleep, especially for quality sleep. So it's not at all recommended to try to help you get to sleep. And it'll ruin deep and REM sleep. And then CBD is actually TBD. So there's a lot of studies coming out now showing that it actually may be helpful, but the studies are not conclusive right now. So it could be because of some of the anti-inflammatory effects that CBD offers. It could be how CBD, affects certain parts of the brain. But right now there's not clear evidence to suggest either way. So people who go through the program who may use CBD oil or, who use CBD for different reasons, there have been times where we will do a little bit of an experiment in the 4 weeks. Like we'll do, okay, let's take a look at your sleep, like the first week, week 2, drop it. Week 3, I'll take a look at your sleep just to make sure that there's no like kind of rebound effect. And then that way we have some data to show, what CBD is doing for you as an individual.
I guess the difficult thing with a lot of things like that too, they're great sedatives. They help you get to sleep, but I guess the big issue being it just doesn't keep you in quality than the deeper sleep.
Yeah, like sedation is quite different than a natural sleep state.
That's a great question.
The only other thing I think I want to talk about quickly is before we end, if there's no other questions, is just caffeine. Because I don't think we talked about this. So caffeine is obviously it's a stimulant, and caffeine affects our sleep more than I think people think it does. So I just wanted to bring up a couple points. So I mentioned before adenosine, that's a chemical that we have in the body that increases as the day goes on, and this leads to this feeling of sleepiness. It causes the sleep pressure, and caffeine will block it. So caffeine will make you feel alert throughout the day and will block that sleepy onset of adenosine. But the other thing about caffeine is caffeine has a half-life about 5 to 7 hours. So what that means is that 50% of your caffeine concentration will be in your bloodstream, like 5 to 7 hours from the onset of having it. So really try to have your caffeine like no later than noon. Because caffeine will disrupt your sleep.
which is a tough one too, because I used to be like this, especially when I was in school. I'd be so tired by the end of the day. I could have a coffee at 9 o'clock and I'd still fall asleep well. And then going back to my perception of that at the time was I was getting into quality of sleep because I could get to sleep quickly. But clearly that would have been disrupting my time in REM sleep and things along those lines. So I think that's a big misconception too. Is there a time or a preferred schedule, like where you like to cut patients off? Like if people are having issues with caffeine throughout the day, what's your general recommendation, like in terms of cutting off any high dose of caffeine throughout the day?
People don't love this, but I say noon, but honestly, ideally 11, even like 11. I mean, I sort of work through this with the person as an individual, see what kind of job they have, if they're a shift worker, if they're not a shift worker, what time, like what chronotype they are. Like we really I ask a lot of individual questions around this. But you know, the other thing too is that there are sometimes people are very fast metabolizers of caffeine, and so there are some genetic tests that will tell you whether you can metabolize caffeine quickly or slowly, and sometimes people know that. So that's another like individual thing that we talk about with caffeine. But on a general rule, just remember this half-life, and that you don't want circulating caffeine in your bloodstream when you're trying to get to sleep, because your brain will be fighting this caffeine and disrupting your sleep.
That's great. Actually, another question I had too, just because it got brought up in the last one, with looking at chronotypes, like in your experience thus far, are there easier chronotypes to deal with in terms of modifying sleep? Is it easier working with somebody who's an early riser or somebody who goes to bed later, or is it all comes out in the wash?
No, it's actually just like a lot around society, right? It's easier to deal with. I mean, it's easier for people to be earlier chronotypes because of the way society, looks at sleep.
They're rewarded. Yeah.
They're rewarded. Early bird gets a worm. It's like it's too bad for late chronotypes because it's more difficult for them. It's more difficult for them to get, different types of work, and people can look at them as being lazy because they want to sleep in, and it's really unfair. And so you really, the other thing I say is that you really should pay attention to this in your adulthood, because teenagers will be late chronotypes. That's like a natural evolutionary process that teenagers will go to bed late and wake up late. So, just because your teenager is doing that doesn't mean that they're going to be a late chronotype. You have to see what they're like in early adulthood. Amazing.
Well, I learned a ton today. I'm sure everybody did here. This is a great resource for all of our patients. Before we do wind up wrapping up, I'll just leave another minute if anybody has any questions. I'll end up with one last one for myself too. But I guess throughout your experience, we talked about things that you learned from the program with sleep. If there's one piece of advice that you could give to everybody, like right now, in terms of like out of all the advice you gave me, looking at supplements to timing to regularity, is there one thing you'd want to leave everybody with in terms of something we can take home tonight and maybe attempt or start?
Yeah, it's actually an attitude. Sleep is non-negotiable. It's your life support. It's your superpower. You got to pay attention to it, and you got to treat it like it's gold for you, and you got to prioritize it. So it's more of an attitude around sleep. That's what I'd like to leave you with.
Amazing. Well, thank you so much. It's great having you on here for this one again. And we'll keep everybody posted on our last of 3 talks on longevity. But thank you again for your time, and I hope everybody has a great night.
Yeah, thank you so much, everybody. Thanks for joining. Thanks for hosting, Kevin. Thanks, Nance, for helping.
Thanks. Take care, guys.